Welcome to SLP Nerdcast, the #1 professional resource for evidence-based practice in speech-language pathology. I'm Kate Granbois.
And I'm Amy Wonka. We are both speech-language pathologists working in the field and co-founders of SLP Nerdcast.
Each episode of this podcast is a course offered for ASHA CEUs. Our podcast audio courses are here to help you level up your knowledge and earn those professional development hours that you need. This course, plus the corresponding short post-test, is equal to 1 certificate of attendance. To earn CEUs today and take the post-test after this session, follow the link provided in the show notes or head to slpnerdcast.com.
Before we get started, one quick disclaimer. Our courses are not meant to replace clinical advice. We do not endorse products, procedures, or other services mentioned by our guests unless otherwise specified.
We hope you enjoy the course.
Are you an SLP or related professional? The SLP Nerdcast Unlimited subscription gives members access to over 100 courses offered for ASHA CEUs and certificates of attendance. With SLP Nerdcast membership, you can earn unlimited CEUs all year at any time. SLP Nerdcast courses are unique, evidence-based, with a focus on information that is useful. When you join SLP Nerdcast as a member, you'll have access to the best online platform for continuing education in speech and language pathology. Join as a member today and save 10% using code NERDCASTER10. The link for membership is in the show notes.
Welcome again to SLP Nerdcast. If this is your first time listening, we're so glad to have you as part of this nerdy adventure. SLP Nerdcast is produced bi-weekly, and our goal is to disseminate research and evidence with clear clinical application so you can apply what you learn almost immediately in your job. This episode is a little different than our other episodes. This episode is part of an online digital podcast series called Leadership in Education and Allied Health Professionals, or LEAHP for short. If you'd like to earn ASHA CEUs for this episode, use the link in the show notes to register for the series or become a member at www.slpnerdcast.com. Registration for this series is included in the SLP Nerdcast membership. If you're not a member, don't worry, you can still register to earn ASHA CEUs and certificates of completion. You can also get access to live events, our speakers in a private discussion board, and a downloadable program with course details. For being an SLP Nerdcast listener, you can use the code SLPLEADER to get 10% off registration. See the show notes for links to register and the discount code. Enjoy the episode. Welcome, everybody, to today's episode. Today, we are here to talk about leadership. Most of the time, we think of leadership as a job title, right? It's your supervisor, your lead SLP, your department head. In our field, we have so many different titles, names for this position. It's usually the person that you report to. And while that might be one example of leadership, it is no way represents leadership as a general concept.
Because leadership is not a management structure.
Correct.
You can be a manager and not be a leader. You can be a leader and not be a manager. I'm super excited to get into our discussion.
Yes, because we've all had the bad boss, right? Like we've all had the person who is in a quote leadership position who does a terrible job of leading people. And similarly, every single person listening to this episode has the capability of acquiring leadership skills and becoming a leader in their workplace setting without having a job title and without being granted the power of tracking PTO or whatever it is. And that's really that's at the heart of what we want to talk about today and at the heart of why we decided to create this series. For those of you who have joined our podcast before, you often hear us talking about the why. So why should we care about this? Why are we talking about leadership in our already super busy lives? And that applies here. Why should we care about leadership? We have the capacity without leadership titles to improve the level of care in our environments and how we can provide that care to our patients. Leadership skills can be self-directed, right? We don't necessarily have to wait for a quote promotion in order to become effective leaders and agents of change.
And I think connected to this is also the piece of Viewing yourself as a leader and identifying where you can be a leader in your job environment and which aspects of leadership resonate most strongly with you also helps us feel more agency and more control over our job environments. When you're able to view yourself as somebody who could be a potential change agent, things aren't just happening to you. You are part of what could change. And whether that's really small changes, like you want to get some different materials and you're hoping to get them funded externally, or larger changes, if you're school based and want to change how MTSS is done or RTI is done. Those are all things that we can do. We have the power to do that as clinicians, and we don't all have to rise the hierarchical ladder of our workplace in order to be part of that change. And I think that that's also a really empowering thing.
I totally agree. And as you were saying that, it was making me think about really making me think about myself as a newer clinician, where I was just grateful to have a job. I was grateful to have a job. I was grateful to have health insurance. I was grateful to be able to pay off my student loans. When you're new in the workforce, or at least when I was new in the workforce, I didn't realize that I had leverage. I didn't realize that I had negotiating chips. I didn't realize that I had the potential to manage up or negotiate for improved working conditions. And I think just zooming way out, it's important to even acknowledge for a second that we have that capacity. We have the opportunity, even if you are new in your workplace, even if you are new to the field, you have the capacity to develop those skills and to be an agent of change, exactly like you said. Okay, so that's the first reason. That's the first reason why we should care. The second reason why we should care is that leadership and advocacy play a really big role in reducing the research practice gap. And I know we've talked a lot about the research practice gap on this podcast. We're going to talk more about it today. But for now, I think it's really important to acknowledge that when we create change in our workplace, positive change in our workplace, when we improve our working conditions, we have the capacity to better serve our clients. And I always tell the story of my poor colleague here in Massachusetts. She works in a public school. She has a caseload of 146 students. I am not joking. She is not reading new research. She is not spending her time diving through different treatment protocols or thinking about best practices. She is trying to stay in compliance. She is trying to eat her lunch. I know for a fact she's crying in her car, which is, become the tongue-in-cheek description of how we feel in our jobs. There is room there for better advocacy. There is room there for her to advocate, to chip away at her to-do list so that she has more bandwidth to think about implementation, to think about best practice, to think about recent research. But it's a completely unreasonable expectation for her to do that, for all of us to do that, if we are working under conditions that are unreasonable or stressful or traumatic or whatever negative descriptor. And this link between advocacy and research and practice, this link between leadership and research and practice is really what we want to get at, and one of the reasons why we should care.
And I think connected to that, even if you don't have as dramatic as an example as, and every time you give this example, it hurts me and makes me angry that that's even happening anywhere. But I think for those of us who aren't in that level of, clearly, ridiculous working conditions, the expectation that somehow apprising yourself of the research and staying up to date on all of that is something that's done in your own time, out of your personal time, is still a problem. So I think whether you're that person with 146 students on your caseload, or you're somebody who has a more manageable workload, if there's not time built in already into your day to allow you to stay up to date on this and to afford for professional development, that's another piece where kind of the two parts intersect, where you can advocate for the ability to stay up to date on best practices in the field.
Yes. All right. So we've already touched on the two main topics that we're going to address today. So quickly, I just want to mention that today's episode is offered for 1/2 hour of professional development or 0.05 ASHA CEUs. It's a bit different than our regular conference. It's a bit different than our regular content. This episode is the first in a series of episodes that we're producing in April and early May as part of the Leadership in Education and Allied Health Professionals series. And you can get more information about that in the show notes. Without further ado, let's read our learning objectives and financial and non-financial disclosures. Okay. Learning objective number 1, list 3 qualities of leadership that can be embraced outside of a defined supervisory role. And learning objective number 2, describe the role of leadership in closing the research practice gap. Disclosures, Kate Granbois, that's me. My financial disclosures, I am the owner and founder of Granbois Therapy and Consulting, LLC, and co-founder of SLP Nerdcast. My non-financial disclosures, I'm a member of ASHA SIG 12 and serve on the AAC Advisory Group for Massachusetts Advocates for Children. I'm also a member of the Berkshire Association for Behavior Analysis and Therapy.
Hey there, Amy Wonka. That's me. My financial disclosures are that I am an employee of a public school system and co-founder of SLP Nerdcast. My non-financial disclosures are that I am a member of ASHA and the SIG 12 group, and I serve on the AAC Advisory Group for Massachusetts Advocates for Children.
All right, let's dig a little deeper into our first learning objective. Let's talk about how leadership is separate from a job title and supervisory responsibilities. We've already given the broad strokes of this. And I know that we've already mentioned that we think of leaders as people in our field who are supervisors. We think of them as positions of power. We tend to think of leaders as people who have traditional supervisory or leadership responsibilities. These are things like our cringy performance reviews. Nobody wants a performance review, right? It's like the day of like the most anxiety, where someone might give you a whole bunch of critical feedback that feels really, really icky instead of more supportive. We think of leaders as people who are tracking our PTO, determining our compensation. But really, this has nothing to do with true leadership skills. Those may be components of leadership or components of a supervisory or leadership job description, but that's not necessarily what defines leadership. And in a minute, we're going to dig a little bit into some of the literature and read some of the qualities that go into leadership. I want to talk for a second about the bad boss. So everybody has had the quote bad boss, and we are not naming names. We are not necessarily talking about our own bad bosses, but this is a phenomenon that so many of us have experienced. Just acknowledging for a minute that just because someone is a boss doesn't mean that they have good leadership skills.
Yeah, and I mean, I've had a few different jobs. I've worked in several different work environments in 2 different states in the United States, and I've also been, I would say, super fortunate to have had at least 2 different exceptional boss experiences as well. And having experienced kind of the full continuum of being managed and supervised by other people, some of whom are speech language pathologists, some are not at all. You really feel the difference. And I think it has a quite pervasive effect in your overall feeling about your work environment in general. And I think that that is something for somebody who is in one of those managerial leadership supervision type roles, to recognize the really significant influence that they can have just on their employees' actual like day-to-day work environment. When you feel, having been fortunate to have some pretty awesome bosses. At some of those times, I also went through some very stressful work things. We had some like very stressful like legal cases and things like that are very anxiety provoking, as a speech pathologist, especially as a younger speech pathologist. And knowing that the person in the leadership role, your supervisor, your manager, is supportive, trusts your abilities, stands behind you, is somebody you can approach with questions and concerns, is somebody, you can let your guard down around and be real with where you need support, is something that you really feel the absence of when it's not there,
Totally. And I think it begs, as you were talking about the legal cases, it brought to mind all of the other stressful moments we have. Like if you're working with a family or a patient who is frustrated with your service or has complained about your service or is deep in grief and you're having a really difficult time supporting them or connecting with them in a way that's meaningful. There are so many things that we do in a helping profession that contribute to those feelings of stress and burnout, which is another thing we're going to talk about a lot in this series. But it sort of begs the question. So if our supervisors or individuals who are in positions of power are not necessarily leaders, and leadership is something that we're uncoupling from those components, those supervisory roles, those traditional leadership roles, then what is leadership, right? It begs the question, what are qualities of leadership that we can address, grow into, acquire? And we found a really great article that we want to unpack a little bit today. And Amy, I'm going to let you say the title of the article since you found it so humorous.
Oh no, I'm not in that spot in my notes. Let's see. Okay, leadership, finding your inner Throgmartin by Leanne Golper.
Full disclosure, in our notes while we were writing this episode, we thought it was Throgmartin at first, and perhaps it was a typo, but it's not. In case you're listening and you want to go find this article, the notes are there's a link in the show notes, and it's Leadership, Finding Your Inner Throgmartin with a TH sound, published by Leanne Golper in Perspectives on Administration and Supervision. If you have interest in developing more leadership skills, we highly recommend this article. It's a really easy read as far as peer-reviewed published literature goes, and it's very comprehensive in terms of outlining all the ways that you can develop leadership skills outside of that traditional supervisory or leadership position of power. We're going to review the main points of the article and list a few specific qualities of leadership that a clinician can develop outside of an official supervisory position. But again, all of that information is contained in the article if you want to do a deeper dive. One of my favorite lines in this article is something that the author mentions right in the first paragraph. And the quote is right on the first page, page 39, if you're in the manuscript. Each of us has leadership nuggets within us. And maybe it was the word nuggets. I don't know. Something about that quote really sort of struck me. She goes on to make the point that likely somewhere in your DNA, each of us has the potential to be a risk taker, an action taker, a visionary, a challenger of the status quo, an entrepreneur, an organizer, a plotter, or a planner. Think about all those things. I'm going to read them again because that list was so powerful for me. Risk taking, action taking, being a visionary, challenging the status quo, being an entrepreneur, organizing, plotting, and planning. Not one time in that list did the author mention some component of being given permission to do those things, right? We are all capable of taking risks. We're all capable of taking action, envisioning something different, challenging our status quo, learning about entrepreneurship, being an organizer of some component in your workplace, or plotting and planning. These qualities, they don't come with a title, and they don't happen automatically just because you were promoted. She mentions that most of the time leadership can mean just showing up. So sometimes if we just show up to address the problem, just choosing in that moment to show up either metaphorically or physically to support other people in your environment. How powerful is that? Just showing up to support your colleagues.
I think it's great. And when I think about times where I have felt not as supported by the folks who were in charge of the actual managing of me as a staff, those were times when I think I look even more heavily to my not formal manager peers, right? So I'm constantly accessing leaders who do not have that job title in my work environments when I'm needing that extra support, or I do need somebody to serve as a sounding board, or I do need somebody, to maybe band together with me on a project that I think, would benefit my students or benefit my school or benefit my patients, depending upon my work environment. So I think the reality is, not only is that beneficial for you as the person who's able to exhibit those leadership skills and help your colleagues, it can be really helpful. And if we're all doing more of that, we're creating communities of support within our work environments, which is awesome. And it doesn't have to be another speech language pathologist. I think as somebody who's worked in a bunch of different schools, sometimes you're the only speech language pathologist there in that building. So you may find leaders from other areas to serve as your support network. But yeah, plotting, planning, and bringing new ideas. Often the people in charge don't have the knowledge that we may have as speech language pathologists or other allied health or providers or educators. So they might not even know these ideas are ideas that we should be considering.
Right. Or to your earlier point, they're not SLPs, so they don't understand the problem. They may not have the content knowledge to show up and help. And the author of this article makes specific mention about solving problems and accomplishing goals. Not only that, but motivating and supporting others to accomplish a goal or bring a vision into reality. And at the end of the day, so many components of leadership are really just about showing up and supporting your colleagues. We don't have time to dig into this article in full detail, but we wanted to quickly list and summarize some of the qualities of leadership that are described so that everyone listening can sort of take a moment to reflect on what skills they have. So if you're listening to this list and reflecting on what skills you may already have, regardless of your workplace, regardless of your title, regardless of your position of power or perceived power, because actual power and perceptions of power are two very important but very distinctly different concepts. And just take a minute to think about what you could work on, what qualities you may already have, or what qualities of leadership might be the most beneficial given the personalities, given the workplace culture, workplace dynamics, in terms of showing up for your colleagues and influencing for change. So first I noticed in this list, and this is truly my biased opinion of the article. So again, I encourage everyone to read for themselves, draw your own conclusions. But I noticed that many of the skills listed involved a lot of deep reflection and work related to compassion, bias, personality, and temperament. And these were things like flexibility, empathy, integrity, optimism, kindness, unselfishness, being trusting, being confident, being patient, and having a sense of humor. All of those things are really rooted in how you define yourself, what you bring to the table in terms of your interactions and your ability to interact with others. This really sort of stood out to me. I mean, I don't know if you had the same impression.
Yeah, I mean, I think it takes just reflecting on some of my awesome bosses that I've had. I would say they tick basically all of these. I would circle them to describe them. And I think that there is a piece of, if you're in a management type leadership position, particularly as someone who's being managed, you feel the effect of that person's people skills, right? If somebody is skilled with people, then you as the person being managed feel more comfortable because they're better able to tailor their management to your needs. And I think in general, for people to be able to do that, you need to be in a pretty comfortable place with yourself as a person.
Totally.
But
And I was thinking to myself as I was reading this list that you can't learn to be kind in a webinar. You can't necessarily.
I mean, maybe. I haven't taken that webinar yet, but
I mean, maybe you could, but just thinking of, being unselfish, creating a trusting environment, having a sense of humor. These are all things that are difficult skills to acquire in a management training. As a side note, most of our workplace settings don't really offer quality management trainings, right? We get promoted based on tenure or clinical skills. So again, just sort of zooming out, if you're listening and interested in concepts of leadership or developing leadership skills, take a minute to think about some of these softer qualities and how that might be rooted, or how you could develop and work on some of these things in terms of your relationships with your colleagues and showing up for others to support other people in your workplace.
I mean, the article does a great job talking about the integration of multiple different types of skills that you need to have in order to be an effective leader. And looking forward into the notes, the next section we have is organizational skills. And that's also really important. You can be kind and empathetic and super caring, but if you're not organized, it makes it hard to accomplish tasks. So if
Yep.
you are trying to be a task-oriented leader, whether that's your job title or you're trying to maybe do an initiative at your school around MTSS or something like that, or change the way you do screening at your outpatient clinic, you also need to be organized to get those things accomplished.
Right, exactly. And the list of things that were related to organization here were being organized, being strategic with your planning towards a goal, continually engaging in big picture thinking, being able to multitask, and having knowledge of policy and procedure. And I think that I love how you took a step back and talked about integrating all of these things, because you can be super empathetic, but if your life exists like mine, sticky notes everywhere, and you are supposed to show up to a union meeting, but you forgot because you didn't write it in your planner or something. I mean, we're really talking about integrating a lot of these different skills. Similarly, looking forward in some of the interpersonal skills that the author lists, these are things like being a good communicator, being a team player, being respectful, demonstrating professionalism. And this one was my personal favorite, knowing the aspirations of a group. That requires really good active listening. So being able to take a minute, think about the wishes and aspirations and goals of your colleagues. And instead of just showing up to do what you think is right or what you think is best for the group, really taking a minute to sample the wishes of everyone in the group and consider that and integrate it into the vision, into the goal, while also being very organized about plotting, planning, and strategizing.
Yes, precisely. The last category, the last sort of bucket that these qualities are sorted into would be those much more closely related to business and taking action. So things like being courageous, having an entrepreneurial spirit, being a tough negotiator, which I think you made such a good point earlier that we often don't even think of that as an option for us as speech pathologists, particularly. Holding people accountable, being decisive, understanding numbers and budgets, and knowing the limit of your power and role within an organization. So just having that self-awareness.
Yes. And this is, I think, another really understated component of knowledge in our field. And we're going to have a whole course about this in this year's LEAHP series, specifically related to negotiating and understanding our funding sources. So, wherever you work, it's a business. Even if it's doing really good work in the community, even if it's a nonprofit doing really good work, there has to be some healthy component of funding, because no one volunteers 100% of the time, right? So there are always these components of finance, of budget, of business, of funding that our managers or people in positions of leadership have to consider to make sure that the planning that we're doing, the strategizing we're doing, the visions that we have make sense within those very real and sometimes unfortunate financial restraints. And the author makes the point that all of these skills together take practice, right? Which makes a lot of sense. It's like any other skill that we develop. So if you're listening and leadership skills are something that you would like to develop, a key takeaway here is that you don't necessarily need to wait for a promotion to develop leadership skills. You can start to work on these leadership skills and become a leader in your workplace without a role, without a job title. Sometimes this might take a little bit of time. It might take volunteering or tackling a problem that you and your colleagues may face as a barrier in your workplace. Just know that leadership skills are within your reach. They are something that you can acquire. They are something that you can practice. It will not happen overnight. And if you have questions about any of these things, we encourage you to go to the article or send us an email. If it's not already obvious, I could talk about this for 1,000 years. So please reach out to me if you have questions. All right, moving on to our second learning objective to talk about how this relates to the research practice gap. So we've already talked about why we should care, right? Improving our workplace settings gives us the bandwidth to provide good quality, patient-centered care that is rooted in evidence, which is the whole reason for our jobs to begin with, and the whole reason why we went to graduate school for however long you went. So that's our whole jobs to begin with. But what if I told you that it took 17 years for a piece of research to become routine, clinical practice. 17 years.
Every time I hear this number, I'm kind of floored by it.
It's completely shocking. And if you want a reference for that, it's in the show notes. It's Ballas and Boren 2000. And the exact statistic is that it takes 17 years to implement 14% of research in routine clinical settings with our standard dissemination methods. So all the science we learned, all the skills we have are likely not new, right? Not necessarily as fresh as we want them to be. And maybe there's new science, or maybe there's newer information, or maybe there's a different implementation strategy or a different treatment that we could be applying in our jobs to help our patients even more. But we're not able to because of this research practice gap, not to mention a caseload of 146 and crying in our car, right? We're going to continue to use that as our worst case scenario example. And this is one of the biggest reasons that we should be caring about the research practice gap. And that gap is riddled with problems across the whole pipeline. I like to think of it as a pipeline, so it gives me a nice little graphic in my head. And on one end, you have the researchers or the knowledge creators who are asking the questions and producing the knowledge. And on the other end, you have us as clinicians who are applying that research and applying that knowledge. And through that whole pipeline is riddled with problems. So on the researcher's end, research is rarely informed by clinical practice, which means that our researchers are not asking the right questions that are meaningful to us as clinicians. Researchers face a whole bunch of barriers on their own in terms of grant writing and tiered funding that we're not even necessarily privy to, right? So there's all these barriers on the researcher's end. But let's talk for a second about what happens on the clinician's end. And going back to this worst case scenario of my colleague who has 146 students in the school setting. There is zero way that this poor woman is keeping up to date on the most recent research in our field. She's staying alive. She's showing up to work every day. Our jobs are so difficult, and we're constantly trying to navigate broken workplace environments. Many of us have inadequate salaries. Many of us have entirely too much workload. Many of us have caseloads that are totally out of balance with our workload. A lot of us aren't given prep time. A lot of us don't have administrative support. So even if you're not in this worst case scenario of 146 students in a school, you could be working in a hospital setting with a supervisor who has zero knowledge of clinical practice and has productivity expectations that are totally unreasonable for the population that you serve. One of the best things that we can leverage on the clinician end is leadership and advocacy. And advocating for better leadership or different leadership, or advocating for ourselves for workplace conditions that's to better support the uptake of new knowledge and new research. And sometimes we can't do that without solving some of these workplace problems or these clinician-facing problems. So many of us as speech pathologists are effectively working in a broken system. I'm not sure I want to get anybody up on a soapbox about our broken healthcare system.
But I could if you wanted me to.
I know you could. And those of us who are, so if you're working in a medical setting, you are likely facing a lot of challenges related to funding and insurance and hospital red tape. And I'm just thinking about my back to our days at the outpatient hospital and all of the unreasonable expectations we faced in terms of productivity. And if you're working in a school, you're also in a different kind of broken system, depending on the district that you're in, if you're under-resourced, if you're understaffed. So many of us work within these broken systems. And regardless of your workplace hierarchy, regardless of what your job title is, all of these things, all of these professional skills, all of these leadership skills can help us leverage the power that we do have to create better working conditions so that we can focus our time on what matters, which is providing high quality, patient-centered care that is rooted in the best evidence that we can find and help closing that 17-year gap. But we can't be expected to do that if we have a caseload of 146.
No, and as a field, the more that we as practitioners see ourselves as leaders and see ourselves as having the power to push back against these some of these, I think that back when ASHA was recommending a caseload model, which they haven't for so long, I think their absolute maximum was 40 students for a school-based SLP. So, if we're not taking responsibility and pushing back within the constraints of our like personal finances and job requirements, and like maybe your friend doesn't have any other options. But the more that we're banding together and pushing back against things like this, the better able we are to actually be speech pathologists. I don't know how you're even functioning as a speech pathologist when you're to that level. I mean, that is multiple times over that recommended cap. So I think there's also responsibility for us not only to have the time to read research, but I mean, there is research that shows when your caseload is past a certain point, it dictates the recommendations you make around your clients, not their areas of need, not their values, not, what the curriculum demands are. It's based on your schedule and how many people you have. So right there, that's a problem. And when we see ourselves all as leaders, we can speak more loudly with one voice, whether we are in healthcare or education or any other setting, to really shift some of these norms that are in place and are barriers to us providing effective intervention.
I hope everybody listening feels at least a little bit empowered in acknowledging and doing a quick little head nod to the barriers that we're up against and how we do have bargaining chips. We do have places and positions of power within our workplace setting, and we have the opportunity to acquire the skills to actually be agents of change in our workplaces. Stay tuned for the rest of this series. We're going to be talking about so many things related to leadership to try and create change in our field. So stay tuned. There's more information about the series in the show notes. If you have any questions, please email us. As you've already heard, I could talk about this for 10,000 years. We both could. So email us anytime, info@slpnerdcast.com. Thank you so much for joining us. And we are really excited to learn with you this year. Thank you for attending the first annual LEAP event. The theme of this year's LEAP is advocacy. We realized as we sat down to talk about leadership that there were numerous ways we can think about leadership and developing our leadership skills. Working towards advocating for improved working conditions, inclusive spaces, and job satisfaction is one of the most important things we can do to improve the clinical care that we offer our clients and patients. This year's series is going to offer 6 one-hour courses in addition to this episode, bringing the total to 6.5 hours of professional development, or 0.65 ASHA CEUs. The topics we will cover include managing up to create better relationships with our bosses, developing skills to negotiate a salary and negotiate for other resources in our workplace setting, advocating for workload over a caseload model, advocating for inclusive spaces through the lens of the multicultural caucuses at ASHA, and creating ethical mentoring relationships with clinical fellows, graduate students, and other SLPs new to the field. The speaker lineup is incredible. We are thrilled to welcome A.C. Goldberg of Transplaining, Janet McNichol, the Chief Human Resources Officer from the American Speech and Hearing Association, Kelly Farquharson of Florida State University, Mindy Booth and James Hook of the Tandem Group, and an entire panel of speakers from the head of each of ASHA's multicultural caucuses. Each of these courses will be offered as a live event on Tuesday evenings at 7 p.m. Eastern Standard Time through the month of April and the first 2 weeks in May. The recordings will be made available 2 days after each live event on our podcasting platform and our YouTube channel. All of the LEAP materials, including access to live events, is included in the SLP Nerdcast membership. If you're not interested in membership but would like to attend, you have the option to purchase a ticket to access live events, ASHA CE processing, and certificates of completion, along with the downloadable series program with detailed course information. Participants and members will also have access to an exclusive bonus course about burnout, as well as a private community where you can ask questions of our expert guests and course instructors. We are incredibly passionate about this information and giving each of us the skills to advocate for change in our workplace. Please join us this spring for the first annual LEAP series. We cannot wait to learn with you all.